So, hello students. Good evening to all of you. Yesterday, we have discussed the upper limb, day before yesterday. So, today, let us discuss the thorax. Thorax is a small topic, students, but everything in thorax is very, very important for you. Okay, so, bachcho, starting with the thorax now for you. Sit back, relax, enjoy the lecture. If you have any doubts, you can ask me later at the end, right? So, now, have a look at this. Yes, bacho. Yes. Rose, fine. Now, if you see a thoracic vertebrae, the vertebrae are kept on the table. During the table viva, the vertebrae are kept. And the examiner is going to ask you, what is this vertebrae? The moment you look at a heart-shaped vertebral body, you say this is a thoracic vertebrae. And the first point of identification given by the students is, it has got a heart-shaped body. But no, that's not the first point of identification of a thoracic vertebrae. What is the point of identification then? If you see the body of the thoracic vertebrae, there's a facet here. And there's a facet on the transverse process of the thoracic vertebrae. Okay, so actually this is half a facet, demi-facet on the body of the thoracic vertebrae and a complete facet on the transverse process of the vertebrae, plus a heart-shaped body. So this would tell us that this is a thoracic vertebrae, right? Now, what are the parts of the rib, students? This is the head of the rib, right? That's the head of the rib. Hi, hello to all of you. This is the head, that's the neck of the rib. This is the tubercle of the rib. That's the tubercle and that's the shaft of the rib. So head, neck, tubercle and shaft of the rib. So this is another very commonly asked question in the viva. So when you hold the rib in anatomical position, this part, the head should be behind, right, posterior, and the shaft should come in front. The shaft articulates with the costal cartilage. What is that joint known as? Costochondral joint. And the head of the rib articulates with the body of the thoracic vertebrae. The tubercle of the rib articulates with the facet on the transverse process. Some examiners will tell you to articulate the thoracic vertebrae and the rib, and the students are not able to articulate. So, bacho, just practice that. You take a thoracic vertebrae, you take a rib, and you try to articulate it. So, the head is going to articulate with the body of the thoracic vertebrae. The tubercle of the rib articulates with the transverse process, and the shaft in front is going to articulate, no, not with the sternum, students. It articulates with the costal cartilage, correct? What is that joint? That's the costochondral joint. What is this joint? This is the costovertebral joint. And what is this joint known as? This is the costotransverse joint. So what are the joints which a rib is going to form? Number one, costovertebral. Second, costotransverse. And the third one is costochondral joint. And children, all these joints are synovial joints, right? And there are movements which takes place at this joint. The examiner will ask you to demonstrate the movements of the ribs. So there is one movement in which the rib goes up and goes down. So this is known as the bucket handle movement. This must have been done in physio also. So this bucket handle movement is going to change which diameter of the thorax? The transverse diameter. The second, when we breathe in, the ribs go up, the ribs go down, the ribs go up, the ribs go down. What is this movement? This is known as the pump handle movement. And this pump handle movement is going to change which diameter of the thorax? The anteroposterior diameter, correct? And third is the contraction of diaphragm. When we breathe in, the ribs go down, that increases the vertical diameter of the thorax. But so there's going to be a lecture in Hindi also. FARRE series in Hindi will be posted. So just try to understand whatever you can. If you have any doubts, just let me know. ठीक है बच्चा? Okay. This is in English only, Rose. I'm talking in English only. Clear? So these are the joints which our rib is going to form, and these are the movements of the respiration, and these are the diameters of thorax which are changed during respiration. Perfect? Clear to all of you? So, yes. So the head of the rib is going to point posterior, the shaft of the rib is going to be anterior, and there's a costal groove, correct? The costal groove is facing inferior. That's how you identify the side of the rib, the right or the left side. The bones will be doing, children, later in the last sessions will be revising the bones for you. Fine, perfect. Okay, great. Now coming to this, you get an LAQ, children. You get an LAQ on intercostal space. Now suppose if you get an LAQ on intercostal space, there's nothing like it, because there are plenty of things to write. Like yesterday I was telling on the Telegram session, you always choose a question in which you will be able to write the maximum, because for an LAQ you have to represent 4 to 5 pages with good diagrams in between, right? So try to choose an LAQ. Suppose if you're not knowing the other, so there's no option. But suppose if two LAQs, you're knowing both of them, always try to select an LAQ which will have a longer length to write. For example, intercostal space. Now you get an LAQ stating intercostal space. Describe the intercostal space under the following heads: the muscles, the vessels, the nerves, and the clinical anatomy. Okay, so my dear children, starting with the intercostal space. The space between the two ribs is an intercostal space. There are 3 intercostal muscles to begin with. The first one, the outermost one, what do you call this as? External intercostal. The second one is the internal intercostal. And the third one is, for all practical purposes, we take this as the transverse thoracic muscle. Good evening, bacho. Good evening to all of you. So the transverse thoracic muscle, or it is also known as the innermost intercostal. You take it as innermost intercostal. So external intercostal, internal intercostal, and the innermost intercostal. Now this innermost intercostal belongs to a group of muscle which is known as the transverse thoracicus. Transverse thoracicus. How is the direction of the external intercostal? The direction of the muscle fibers are downwards, forwards, and medially. Look at this. That's downwards, forwards, and medially. The internal intercostal is exactly opposite. It is upwards and laterally. And same as the innermost intercostal. Same as the innermost intercostal. So external intercostal, internal intercostal, and the innermost intercostal. Yes, but I'm telling you. Bagela, yes. So where is the neurovascular plane? Where do the nerves and the vessels lie? Between these 3 muscles, you have got external, internal, and innermost intercostal. Where do the nerves and the vessels lie? The nerves and the vessels, they lie between the internal and the innermost intercostal. Here, they lie between the internal and the innermost intercostal. Where? In the costal groove. And where is the costal groove, bacho? The costal groove is along the inferior border of the rib, right? The costal groove is along the inferior border of the rib. And how is the sequence of structures in the costal groove? It is vein, artery, nerve, from above downwards. From above downwards, right? External oblique is in the abdomen, bacha. External intercostal is in the thorax, right? So the nerves and the vessels of the thorax, they lie between the internal and the innermost intercostal. Where? In the costal groove. And where is this costal groove located? Along the inferior border of the rib. And how is the sequence? The vein, artery, nerve. Vein, artery, nerve. So if you are doing a pleural tapping, if you are removing fluid from the pleura, where are we supposed to put the needle? We will put the needle along the upper border of the lower rib. Upper border of the lower rib. Why? Because to prevent injury to the nerve, to the vessels and nerves. Okay, fine, bacho. Clear? So to prevent injuries to the vessels and nerves, where do we insert the needle? Along the superior border of the lower rib. That answer your questions? That will answer your question. Clear? So students, just understand the statement. The neurovascular plane of the thorax lies between the internal and the innermost intercostal. Internal and innermost intercostal in the costal groove along the inferior border of the rib, and sequences vein, artery, nerve from above downwards. And can anyone tell me this sequence is reversed in which rib? Come on, students, answer this. Normally the sequence is vein, artery, nerve, right? But this sequence is reversed. It is nerve, artery, vein. In which rib is this? Yes, come on, the question is open to all of you. In the first rib. Excellent. Very good to all of you. Very good. So this sequence is reversed in the first rib. That's a characteristic of first rib too. Yes, students? Okay. So this is what you're going to write in the intercostal muscles, the neurovascular plane. Very good to all of you. Now, this is a view of the thorax. Now look, the intercostal space, the rib starts from behind, from the vertebrae, and it comes in front towards the sternum. So an intercostal space would start from behind and it would come in front. The spaces in front would be known as the anterior intercostal spaces, and the spaces behind would be known as the posterior intercostal spaces. Correct? So these are the anterior intercostal spaces that we are looking at. And what is this? What is this? These are the posterior intercostal spaces. Are you able to follow this? So the vessels, why do we divide like this? So the vessels in the posterior intercostal space would be known as the posterior intercostal vessels, and the vessels in the anterior intercostal space would be known as the anterior intercostal vessels. You can see this, anterior intercostal vessels. So students, I'm starting with the intercostal arteries. Just have a look at this. Come on, you identify this artery for me. What is this artery here? An artery which runs on either sides of the sternum inside the thorax. Answer. What is this artery? An artery which runs inside the thorax on either sides of the sternum. Internal thoracic artery. Very good, very good. You remember this internal thoracic artery was giving branches, and these branches were going to perforate the intercostal muscles, and these branches were going to supply the breast. So one of the blood supply of breast would be the perforating branches of internal thoracic artery. Clear? So that's the internal thoracic artery. Now this internal thoracic artery, students, this internal thoracic artery at the sixth intercostal space, look at this, at the sixth intercostal space, it divides into two branches. It divides into a musculophrenic, and the second one is superior epigastric artery. So internal thoracic artery, dorsal side of the rib. How do we demonstrate anterior and posterior intercostal spaces? What is difficult in that? आगे जो है, the one in front is anterior and the one behind is posterior intercostal spaces. That's it. Now the internal thoracic artery at the sixth intercostal space divides into a musculophrenic artery and a superior epigastric artery. Students, this is the superior epigastric artery. Is there an artery with a similar name? Is there an artery by the name of superficial epigastric artery? Come on, answer this. Is there an artery with the name superficial epigastric artery? If yes, it's a branch of what? Yes, bacho, come on, answer this. Come on. Is there an artery with the name of superficial epigastric artery? And yes, if it is, it's a branch of external carotid नहीं है बच्चा, नहीं. Oh, answer. Superficial epigastric artery is a branch of celiac trunk नहीं है बच्चा. Celiac trunk is inside the abdomen बच्चा. Celiac trunk it's not celiac trunk. Superficial epigastric. Yes, Vinay, you got this right. Vinay, very good. Superficial epigastric artery is a branch of femoral artery. Very nice. It's a superficial branch of femoral. External iliac nahi hai bacha. It's a superficial branch of femoral. You should know this, huh? You know the branches of femoral artery, superficial branches, superficial epigastric, the superficial external pudendal, and the superficial circumflex iliac. Good. Try to answer, try to recollect. Very good. So it will be a quick revision. It will be a quick go through the entire session. Okay, fine. So superior epigastric artery, right? So this is superior epigastric. Superficial epigastric is a branch of femoral artery. Very good. Now this superior epigastric artery will enter the abdomen, right? This superior epigastric artery will enter the abdomen. It will anastomose with the inferior epigastric artery. Now this inferior epigastric artery is a branch of No worries. See, even if you make a mistake here, that's okay. There's no need to say sorry, bacho. It's a learning process. Okay, so try to understand, try to learn it. There's not much time to write. I'll just talk. You can see this. You can just take the PDF. You'll get the PDF. Tell me, this superior epigastric artery enters the abdomen, anastomosis with the inferior epigastric artery, which is a branch of external iliac. This inferior epigastric artery is a branch of external iliac. But show, my dear children, do not forget this inferior epigastric artery. Inferior epigastric artery is with respect to the Hasselbalch's triangle. You know this. It forms the lateral boundary of the Hasselbalch's triangle. The inferior epigastric artery differentiates a direct and an indirect inguinal hernia. Now clear? You know everything. You just have to be, conscious and aware. That's it. Perfect. 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 Very good. Very good. Right. So now coming to this arteries. Hasselbalch's triangle, bacha. So coming to this arteries, what are these arteries? These are the anterior intercostal arteries. Okay, just understand now. This anterior intercostal arteries in the upper 6 spaces, students, in the upper 6 spaces will be branches of what? A very, very important question. That's okay, bacha. You have to revise. So the anterior intercostal arteries in the upper 6 spaces are branches of this internal thoracic artery. You can see this. So anterior intercostal arteries in the upper 6 spaces are branches of internal thoracic artery. In the lower spaces, these are branches of the muscular phrenic artery, because the superior epigastric artery enters the abdomen, correct? So anterior intercostal arteries in the upper 6 spaces are branches of internal thoracic artery. In the lower spaces, these are branches of muscular phrenic artery. Perfect. There are 2 anterior intercostal arteries in each space. Have a look at this. There are 2 anterior intercostal arteries in each space. Fine. So this is about the anterior intercostal arteries. Now coming to the posterior intercostal arteries. Just have a look at this. So you can see the spaces. These are the posterior intercostal spaces. So the arteries here would be known as the posterior intercostal arteries. But before you come to the lecture, just have a quick go through. Once you revise and come, so it will be very easy for you to understand, to correlate things. Because this is a FARRE series. So it's a quick revision series, right? So I can just correlate and I can just, bring things together for a better understanding. You should be knowing things, right? Okay. Waghela, just listen. Don't ask in between. Let me finish this, then you ask your doubts. Okay. Now, what is this? What are these? These are the posterior intercostal arteries. And this posterior intercostal arteries in the lower spaces are branches of, what is this artery? In the lower spaces, these are branches of descending thoracic aorta. So posterior intercostal arteries in the lower spaces are branches of descending thoracic aorta. In the upper 2 spaces, just have a look at this. In the upper 2 spaces, it is different. Try to understand this. In the upper 2 spaces, these are branches of what? In the upper 2 spaces, these are branches of the superior thoracic artery, which is a branch of costocervical trunk, which is a branch of second part of subclavian artery, which is a branch of second part of subclavian artery. So, bacha, just try to understand this. Posterior intercostal arteries in the lower spaces are branches of descending thoracic aorta. In the upper 2 spaces, these are branches of what? The superior intercostal artery, which is a branch of costocervical trunk, which is a branch of the second part of subclavian artery. Are you able to follow this? Okay, just one moment. Tell me, axillary artery. We have studied this axillary artery. Axillary artery is divided into 3 parts. By which muscle? Come on, students, answer this. Axillary artery is divided into three parts. By which muscle? Any guesses? You know this. Come on, come on, come on, come on, bacho. Axillary artery is divided into three parts. By which muscle? हाँ बोलो बच्चा राजकुमार आंसर दिस एक्सिलरी आर्टरी इज डिवाइडेड इनटू थ्री पार्ट्स बाय पेक्टोरलिस माइनर वेरी गुड subclavian artery is divided into three parts by which muscle subclavian artery is also divided into three parts ये कौन सा muscle है which muscle is this can anyone answer this these are all very important viva questions बच्चों if you listen to this lecture properly you will be able to answer all your vivas also very well. Subclavian artery is divided into three parts by the scalenus anterior. Scalenus anterior. So subclavian artery has got three parts. Axillary artery has got three parts. Any reference have we come across anywhere? Subclavian artery ke three parts, axillary artery ke three parts. Have we come across this anywhere? Chalo guess. Which was that topic जिसमें subclavian artery and axillary artery comes into picture? ये कौन सा topic है? Yes, the first part of the subclavian and the third part of the axillary. Yes, for your reference, I'm telling you, the first part of the subclavian and the third part of the axillary artery. What is this? Very good. That's the anastomosis on the dorsal aspect of scapula. Very good. Anastomosis on the dorsal aspect of scapula is between the first part of the subclavian and the third part of the axillary artery. That is where this subclavian and axillary comes, right? Okay, perfect, perfect. Matlab subclavian artery is divided into three parts by whom? Scalenus anterior. So, ये subclavian artery हो गया बच्चों. Where is the second part of subclavian artery lying? Where is the second part of subclavian artery lying? Behind the scalenus anterior. And from the second part of subclavian artery, we get this costocervical trunk. This costocervical trunk will give the superior intercostal artery, superior thoracic knee, sorry, superior intercostal artery. This is superior intercostal artery, sorry for that, superior intercostal artery, and this superior intercostal artery will give posterior intercostal arteries in the upper two spaces. Posterior intercostal arteries in the upper two spaces. So in the upper two spaces, these are branches of superior intercostal artery. Just make it superior intercostal artery, which is a branch of costocervical trunk, which is a branch of second part of subclavian artery. Okay, ठीक है बच्चा. I had written superior thoracic artery. Any guesses? Superior thoracic artery. Is there an artery with the name superior thoracic? Answer. हाँ बच्चों. Is there an artery with the name superior thoracic? Anyone? By mistake, I had written superior thoracic artery. Is there an artery with the name superior thoracic? बोलो बच्चों. It's a branch of first part of axillary artery. Very good, Vinay. Very good. Yes, yes. It's a branch. Very good, Rishi. It's a branch of first part of the axillary artery. याद है ना बच्चों? First part of the axillary artery. Okay, fine. Right. So there is one posterior intercostal artery in each space. Students, you get this intercostal artery. Intercostal artery. You get this. One moment. Okay. So coming back to the intercostal arteries, anterior intercostal arteries in the upper six spaces are branches of internal thoracic artery. In the lower spaces, these are branches of musculophrenic artery. The posterior intercostal arteries in the lower spaces are branches of descending thoracic aorta. In the upper two spaces, these are branches of the superior intercostal artery, which is a branch of costocervical trunk, which is a branch of second part of subclavian artery. Clear to all of you? This is clear to all of you? Okay, so that's about the intercostal arteries. So the anterior and posterior intercostal arteries are going to anastomose with each other. Okay, fine. Okay, now coming to the intercostal veins. Bacho, can you answer this MCQ? Come on, students, come on. Superior intercostal artery is a branch of. Now that you know all the options, let us discuss the options too. Costocervical trunk. Children, do you know this thyrocervical trunk? Yes, it's a branch of what? Thyrocervical trunk. It's a branch of what? Excellent, very good. Thyrocervical trunk is a branch of the first part of subclavian artery. Thyrocervical trunk. Okay, it's a branch of the first part of subclavian artery. And this thyrocervical trunk gives a branch. You know what is that? You know what is that artery? Thyrocervical trunk, a branch. This thyrocervical trunk should actually be known as thyroscapulocervical trunk. Subclavian artery, bachcho, will discuss later. I am not going to that. Thyroscapulocervical trunk. Ideally, the name should have been thyroscapulocervical trunk. So the arteries becomes very easy to understand. So the artery to the thyroid is inferior thyroid. You remember this inferior thyroid artery? So inferior thyroid artery is a, yes, very good. It's a branch of thyrocervical trunk, which is a branch of the first part of subclavian artery. And the superior thyroid artery is a branch of, come on, complete the sentence. Superior thyroid artery is a branch of, superior thyroid artery is a branch of external carotid. Very good, external carotid. And this inferior thyroid artery accompanies a nerve. Come on, if you can answer this. Very good, huh? Very good, Snehajit, very good, Rishi. Answer, bachcho, try to answer. Even if you make a mistake, that's okay. This inferior thyroid artery accompanies a nerve, the recurrent laryngeal nerve. You must have read it during the thyroid ke topic mein. Huh? Inferior thyroid artery accompanies the recurrent laryngeal nerve. So we cut the artery as away from the gland as possible, and the superior thyroid artery accompanies the external laryngeal nerve. So we cut it as close to the gland as possible. Okay, that we'll see later. To the scapula is the suprascapular. Suprascapular, and to the cervix. Cervix is the neck. It is the superficial cervical, or some books mention this as transverse cervical. Superficial cervical or transverse cervical. Huh? Some books mention it as transverse cervical. Internal thoracic artery, dorsal scapular artery is a branch of what? Any guesses? Dorsal scapular artery is a branch of. Come on, students, come on. You're answering very well. Excellent. Dorsal scapular artery is a branch of. Nahi, bacha. Dorsal scapular artery is not a branch of external carotid. Polju, no? No, it's not a branch of external carotid. It's a branch. Dorsal scapular artery is a branch of, yes, third part of subclavian artery. It's a branch of third part of subclavian. Just remember, see now, Abhi, we have discussed so much about the subclavian artery. I'll just tell you one very easy way. This is vitamin C, D. These are the branches of subclavian artery. That's from the first part, that's from the second part, and that's from the third part, right? So these are the branches of subclavian artery, the first part, second part, third part. What is V? V is vertebral. Okay, I'll finish it here. What is I? I is internal thoracic. What is T? T is the thyrocervical trunk. Thyrocervical trunk. What is C? C is the costocervical trunk. And what is D? D is the dorsal scapular. Dorsal scapular. Perfect, bacho. So we finished with the subclavian artery. Artery also, very good. So subclavian artery is divided into three parts by the scalenus anterior. The first part is from its beginning to the muscle, second part is behind the muscle, and the third part is after the muscle. How do you remember the branches? It's vitamin C, D. VIT first part, C second part, D third part. V is vertebral, I is internal thoracic, T is thyrocervical trunk, C is the costocervical trunk, and D is the dorsal scapular artery. Perfect. Your concept has to be clear, bacho. Fine. Is this clear, students? Hello. Fine, we'll proceed. So we're discussing the intercostal space, bacha. We have discussed the intercostal muscles. We have discussed the intercostal arteries. Now coming to the intercostal veins, have a look at this. Now students, if you can answer this, what is this vein in front? What is this vein in front? Or for that matter, what was this vein? One moment, one moment. What was this vein? Same. This is the internal thoracic vein. This is the internal thoracic vein. And the same internal thoracic vein is formed by joining of two veins, the superior epigastric and the musculophrenic. Like the internal thoracic artery divides into two, superior epigastric and musculophrenic. So that's how the internal thoracic vein is formed. So the anterior intercostal veins in the upper six spaces, they drain into what? Anterior intercostal veins in the upper six spaces, they drain into internal thoracic vein. In the lower spaces, they drain into musculophrenic vein. Same. Anterior intercostal arteries we have seen, same as the vein. Okay, look at this. So anterior intercostal vein, I'll just make it like this. Anterior intercostal vein in upper six spaces. Anterior intercostal vein in the upper six spaces drains into internal thoracic vein. In the lower spaces, drains into musculophrenic vein. Drains into the musculophrenic vein. Same hai bacho, like the arteries. Anterior intercostal arteries in the upper six spaces were branches of internal thoracic artery. In the lower spaces, these are branches of musculophrenic artery. Now, the most important thing which comes in the exams are the MCQs on this posterior intercostal veins. That's extremely important, bacho. And the azygous vein. So just try to understand this. I'll make a slide for you here. So that's a vein coming from the neck. That's a vein coming from the neck. The embryology will be discussing separately. That's a vein coming from the neck. That's a vein coming from the upper limb. Can anyone tell me what is this vein coming from the neck? Internal jugular vein. What is this vein coming from the upper limb? That's a subclavian vein. The internal jugular and the subclavian vein joins to form a vein here. Any guesses? Any guesses? What is this vein? This is the internal jugular. One comes from the upper limb. That's a subclavian. The internal jugular and the subclavian joins to form. What's the name of the vein? Brachiocephalic vein. Very good. The right and the left brachiocephalic veins. Excellent. Very good. The left brachiocephalic vein is longer. That is embryology. Why it is longer? That's embryological in origin. We'll see this later. So the left brachiocephalic vein is longer, joins with the right. And what is this? Beautiful. This is the SVC. SVC. Okay, so internal jugular vein joins with the subclavian vein. The right brachiocephalic, the left brachiocephalic. The left is longer, joins with the right, forms the SVC. Correct, students? And look, who's this? Who's this? Yo. Who's this? This is a single unpaired. What's that? The azygous vein. A single unpaired vein, the azygous vein. Now, students, I'm discussing the posterior intercostal veins. Be very clear about this. Plenty of MCQs you get. You get short notes on azygous vein also. Okay, let us begin. Right. Okay, we're discussing the posterior intercostal veins. I start. The first right posterior intercostal vein drains into what? The first right posterior intercostal vein drains into the right brachiocephalic vein. That's the right brachiocephalic. The first left posterior intercostal vein drains into the left brachiocephalic vein. Right? Same on both sides. The first on both sides drains into brachiocephalic, right and left. The second, third, and fourth right posterior intercostal veins joins to form a vein here. What's this vein? This is the right superior intercostal vein. And the right superior intercostal vein drains into azygous vein. A very important MCQ. The right superior intercostal vein, how is it formed? By the joining of right, second, third, and fourth posterior intercostal vein. The right superior intercostal vein drains into the azygous vein. So that's a tributary of azygous vein. The second, third, and fourth on the left side joins to form a vein. Same. That's the left superior intercostal vein. and the left superior intercostal vein drains into the left brachiocephalic. The right superior intercostal vein drains into azygos, remember bacho, and the left superior intercostal vein drains into the left brachiocephalic vein. Now, all the veins on the right side, they drain into what? Azygos vein. On the right side, all the veins would drain into azygos vein. On the left side, 5, 6, 7 and 8. 5, 6, 7 and 8 left. Posterior intercostal veins. Joins to form a vein here. What's this? This is the accessory hemiazygos. Accessory hemiazygos vein. So 5, 6, 7, 8 on the left side joins to form the accessory hemiazygos vein. This drains into azygos vein. 9, 10, 11 and 12. 9, 10, 11 and 12 joins to form the azygos, that is the hemiazygos vein. Hemiazygos vein, this drains into, yes, azygos vein. This should be perfect, but this is extremely important. Extremely important. I hope this is clear to all of you. All MCQs. See, if you are thorough with your theory, your MCQs are very easy to answer. Okay, clear students? So the anterior intercostal veins in the upper 6 spaces drains into internal thoracic vein. In the lower spaces, they drain into the muscular-phrenic vein. The posterior intercostal vein, the first right posterior intercostal vein drains into right brachiocephalic. The first left drains into left brachiocephalic. Second, third and fourth on the right side joins to form the right superior intercostal vein, drains into azygos vein. Second, third and fourth on the left side joins to form the left superior intercostal vein, drains into left brachiocephalic vein. The veins on the right side drain into azygos. On the left side, 5, 6, 7, 8 joins to form the accessory hemiazygos. 9, 10, 11, 12 joins to form the hemiazygos. Both of this would drain into azygos vein. Perfect. So that's about the intercostal veins. Now coming to the last topic, the intercostal nerve. I hope this is clear to all of you. So what is an intercostal nerve? What is an intercostal nerve? It's the ventral rami of a thoracic spinal nerve. Intercostal nerve is the anterior primary rami of a thoracic spinal nerve. What happens in rest of the areas? In rest of the areas, the ventral ramus of a spinal nerve forms a plexus. It forms a plexus like the brachial plexus, the lumbar plexus. This is formed by the ventral rami of the spinal nerves. In thorax, there is no plexus. So the ventral ramus of a thoracic spinal nerve runs in the intercostal space, and this is what we call as an intercostal nerve, right? So that's an intercostal nerve. It's the ventral ramus of a thoracic spinal nerve. What are the branches of the intercostal nerve? The first branch is the anterior cutaneous branch. So the first is the anterior cutaneous branch. The second one is the lateral cutaneous branch. And the third one would be muscular branches. Clear, bacho? Are you following this? So we're discussing the intercostal nerve. It's the ventral ramus of a thoracic spinal nerve. The branches, one is the anterior cutaneous branch, which supplies the skin on the anterior aspect of the chest wall. The second is the lateral cutaneous branch, which supplies the skin on the lateral aspect. And the third one are the muscular branches. Clear to all of you? Clear, bacho? Hello. Fine. So this is how you describe an intercostal space. Very good. So you get something, okay, fine. You get something known as a typical and atypical intercostal nerves. That just go through it. Hi, but dekh lo. Fine. Complex anastomosis. बोलता हूँ बाद में बोलता हूँ. Okay. Now, coming to the extent of the pleura and the extent of lung. I'll tell you that later. Extent of pleura and extent of lung. Tell me, extent of pleura in the mid clavicular line, in the mid axillary line, and the mid scapular line. What is the extent of lung and what is the extent of pleura? Answer this, bacho. What is the extent of lung in the mid clavicular, mid axillary, and mid scapular line? Any guesses? Come on, students, you can answer this. Yes. What is the length of the lung? What is the extent of lung? That is 6th rib, 8th rib, and 10th rib. 6th, 8th, and 10th. And what is the extent of pleura? That is 8, 10, and 12th rib. 8, 10, and 12th rib in the mid clavicular, mid axillary, and the mid scapular line. Right? 6, 8, 10, and 8, 10, and 12th rib. So pleura is 2 ribs below. Pleura is 2 ribs below it. Right? So because of this, spaces are formed. What is this angle known as? What is this recess known as? This is the costodiaphragmatic recess. And what is this recess which is formed here? This is the costomediastinal recess. So two recesses are formed here. The costovertebral, the costomediastinal and the costodiaphragmatic recess. These are the two recesses formed here. Fine? Okay. Now, students, this first rib is very commonly asked in the vivas. You get MCQs on the first rib. The first rib you get MCQs. So if I draw a first rib for you, tell me, if I draw, this is the head of the rib, that's the neck of the rib, that's the tubercle of the rib, and that's the shaft of the rib. There's a tubercle on the first rib. Can anyone tell me what is this tubercle? This is for MBBS, bacha. This is for MBBS. What is this? Tell me. What is this tubercle known as? Hello, bacho, bolo. What is this tubercle known as? This is the scalene tubercle. Very good. This is the scalene tubercle. Scalene tubercle. And what is the muscle attached to the scalene tubercle? What is the muscle attached here? This is the scalenus anterior. Scalenus anterior. What is the muscle attached to the first rib on the posterior aspect? Any guesses? This is the scalenus medius. This is what is asked in the MCQs also. So to the scalene tubercle is scalenus anterior. Behind on the first rib is scalenus medius. Scalenus posterior is not attached to the first rib, but scalenus posterior is attached to the second rib. What is this muscle? Any guesses? What is this muscle which is attached to the outer border of the first rib? Come on, students, can you answer this? The muscle attached to the outer border of the first rib. This is the serratus anterior. Very nice, very nice, very nice. ABCD, serratus anterior. Very good, very good. Serratus anterior, bacha, Snehaj, it's serratus anterior. External intercostal is also there, but this muscle is serratus anterior. The first digitation. And if you can just tell me what is attached to the inner border of the first rib. Yes, bacha, come on. What is attached to the inner border of the first rib? This is what we call as Subance fascia. This is known as Subance fascia, or this is what we call as the suprapleural membrane. Suprapleural membrane. This is also known as suprapleural membrane. Students, this suprapleural membrane is going to cover the apex of the lung. You know, pleura is of two types. One is the parietal pleura, the other one is the visceral pleura. The parietal pleura is named differently. One is the costal pleura, one is the mediastinal pleura, one is the diaphragmatic pleura, and one is the cervical pleura, which covers the apex of the lung. Ek minute. Hello, just one moment. Pleura is of two types. One is visceral pleura, the second one is parietal pleura. Parietal pleura is of different types depending on where it is present. If this is the lung, if these are the two lungs, what is this for the lung? Apex. Ye kya hai? Base. These are the two lungs, the heart in between. So what is this surface? The mediastinal surface. Here are the ribs. So what is this surface? Costal surface, right? So the parietal pleura is named accordingly. The parietal pleura which lines this surface is known as mediastinal pleura. The same parietal pleura here is the costal pleura. Here is the diaphragmatic pleura, and the parietal pleura which covers the apex of the lung is known as the cervical pleura. Cervical pleura, right? And this cervical pleura is covered by something which is known as the Subance fascia. Very good, Subance fascia. Yes, again, this Subance fascia is attached to the transverse process of C7, and it is attached to the inner border of the first rib. Inner border of the first rib. Look, you get MCQs on this. What is the importance of this Subance fascia? Can anyone tell me importance of the Subance fascia? Importance of the Subance fascia? C7 to the inner border of the first rib. Yes, yes, Sugyan. What is the importance of Subance fascia? Prevents injury. No, that is not the importance. What is the importance of Subance fascia? It prevents injury of the apex. That's fine. But something else. MCQ ऐसे आता है. See, clinical MCQ. A soldier goes to the border during a war. A bullet hits him at the root of the neck. Fine. He survives. But after some weeks, he finds something is ballooning up here at the root of the neck. Something is, ballooning up. It becomes big, it becomes small. It becomes big, it becomes small. So this ballooning of the lung is because of the injury to the Subance fascia. So what does the Subance fascia prevent? It prevents the ballooning of the lung, apex of the lung. We don't feel when we breathe the apex of the lung comes up, now goes down, comes up. No. Okay, so it prevents the ballooning of the lung. That's the importance of Subance fascia, right? It also prevents injury to the apex. That's fine. Clear hai, bacha? So these are the structures attached to the first rib. This is the scalenus anterior, scalenus medius, the Subance fascia, the serratus anterior. And what are the relations of the neck of the first rib? Relations of the neck of the first rib. Any guesses? Relations of the neck of the first rib. This is always asked by default. Relations of the neck of the first rib. It is SVAN. Swan. A mnemonic. Relations of the neck of the first rib. A very important MCQ. What is S? S is the sympathetic chain. What is V? V is the first posterior intercostal vein. A is the superior intercostal artery, and N is the first thoracic nerve. Students, just remember this, and this is extremely important MCQ. The first rib is always asked in the exams. Costal groove is absent. The structures are reversed. It's not vein, artery, nerve. It's nerve, artery, vein. Okay, bacho. Clear to all of you? So these are the attachments on the first rib, and these are the relations of the neck of the first rib. SVAN. It's medial to lateral. The sympathetic chain, the first posterior intercostal vein, the superior intercostal artery, and the first thoracic nerve. Perfect. Very good. We'll answer this. Answer this MCQ. Yes, Rishi. Answer. अरे बच्चे, अभी लिखा है ना हमने. See, look, your concept has to be that good that you would be confident to label a MCQ as a wrong MCQ. Right? Snehajit, ऑप्शंस रॉन्ग लग रहे हैं. All options are correct, no बच्चों. All options are correct in this. I mean, you have to be that confident. I put this MCQ specifically like this. There might be a mistake while framing the MCQ. You get the benefit of doubt, yes, but you should be confident that this is a mistake. So everything is correct here. Everything is correct. All is attached to the first strip, no? Yes. Human error हो सकता है ना? So there's always 2-3 sets which are prepared, and there are always a hierarchy of the examiners. Like if one examiner sets the paper, it comes to me to validate the paper. So the questions which are given in MCQs are not repeated in theory, because different people sets different papers, different sets of papers. So validation is always very important. Okay, great. Med student, revision हो रहा है बच्चा? Revision हो रहा है? Very good. Now coming to this, very good, very good. It will be a quick revision for the senior students. Right, now coming to this, what is this? This is the bronchopulmonary segments. Bronchopulmonary segments. And bacho, what is a bronchopulmonary segment? A very, very important short note for you, a very important MCQ for you. So what is a bronchopulmonary segment? The part of the lung which is supplied by one tertiary bronchus. Correct. The part of the lung which is supplied by one tertiary bronchus is known as a bronchopulmonary segment. Now, the trachea divides into two primary bronchus. Primary bronchus further divides into, okay, I'll just make this for you. Trachea divides into two primary bronchus, right? For two lungs enough. So two primary bronchus. Each primary bronchus divides into secondary bronchi depending on the number of lobes. So the right lung has got 3 lobes, right? So the right primary bronchus would divide into 3 secondary bronchi. That's the secondary bronchus for the upper lobe, that's the secondary bronchus for the middle lobe, and that's the secondary bronchus for the lower lobe. The left primary bronchus divides into 2 secondary bronchi for the upper lobe and the lower lobe. Now, the secondary bronchus for the upper lobe gives small tertiary bronchus, and the part of the lung which is supplied by one tertiary bronchus is known as a bronchopulmonary segment. This is a short note. Okay, the part of the lung supplied by one tertiary bronchus is known as the bronchopulmonary segment. Okay, I'll just answer this for you. I'm not drawing this. So now you tell me, what is this fissure? This is the right lung. So this is the oblique fissure. That's the horizontal fissure. So what lobe is this? Upper lobe. That's the middle lobe, and that's the lower lobe. Okay. So bronchopulmonary segments for the right lung, upper lobe. Right lung, upper lobe are apical. This is apical. Yes. Apical, anterior, posterior. Bronchopulmonary segment for the right lung, upper lobe, apical, anterior, posterior. For the middle lobe of the right lung, that's medial and lateral. For the lower lobe, the bronchopulmonary segments are apical, this is anterior basal, this is lateral basal, and that's the posterior basal. And there's one more on the medial side. What is that? Medial basal. So how many bronchopulmonary segments are there in the right lung? There are 10 bronchopulmonary segments. Okay, as a first year students, you just need to know this much. 10 bronchopulmonary segments for the right lung. The upper lobe has apical, anterior, posterior. The middle lobe has medial, lateral. The lower lobe has apical, anterior basal, lateral basal, posterior basal, and the medial basal. ठीक है बच्चों? Yes. Coming to the left lung, the bronchopulmonary segment for the left lung. I'm sure everyone must be knowing this. Just a quick revision. So for the left lung, it's apical, anterior, posterior. Now this lobe of the left lung is also known as the lingular lobe. Lingular lobe. This lobe of the left lung is also known as lingular, and the bronchopulmonary segments of the lingular lobe are superior and inferior lingular. Superior and inferior lingular. But show this lingular lobe is a part of upper lobe. Lingular lobe is a part of upper lobe. If you get an MCQ stating bronchopulmonary segments of the lingular lobe are, your answer is superior and inferior lingular. But if you get an MCQ stating bronchopulmonary segment of the upper lobe of the left lung, your answer this. Bronchopulmonary segment of the upper lobe of the left lung. How many? How many? 5. 5 है ना? This 3 and this 2. 5. Yes, very good. Okay, so बच्चों clear? Lingular lobe is a part of upper lobe. Yes, very good. Now coming to the lower lobe, same. This is apical. Apical. This is anterior basal, lateral basal, posterior basal, and one is medial basal. Now for first year, we say there are 10 bronchopulmonary segments for both the lungs. But when you go higher up, when you go in third year and all, you will come to know that this medial basal segment is absent in the left lung. For now, just remember 10 on each side. That is enough. Fine. So clear, bacha, with the bronchopulmonary segment is clear to all of you? Okay. So now, just tell me one thing. Just remember 10 on each side. Okay, look at this MCQ, a very important MCQ. Trachea divides into 2 primary bronchus for the 2 lungs. The right primary bronchus divides into 3 secondary bronchus for the 3 lobes. The left primary bronchus divides into 2 secondary bronchus for 2 lobes. Right? Now you tell me, students, what is this? This is the secondary bronchus for lower lobe. Now this secondary bronchus for the lower lobe is a continuation of, what is this? That's a right primary bronchus, which is a continuation of the trachea. Continuation of the trachea. Okay. Yes. So the trachea continues as what? The trachea continues as the right primary bronchus. The right primary bronchus further continues as the secondary bronchus for the lower lobe. Secondary bronchus for the lower lobe, correct? Now you tell me, this secondary bronchus for the upper lobe gives how many tertiary bronchus? 3. Apical, anterior, posterior. This will give how many? 2. This is medial, lateral, and this will give 5 tertiary bronchus. Yes, apical, anterior basal, lateral basal, medial basal, and that's the tertiary bronchus for, posterior basal segment. That's the tertiary bronchus for the posterior basal segment. What I want you to understand, bacho, the tertiary bronchus for the posterior basal segment is a direct continuation of the secondary bronchus for the lower lobe, which is a direct continuation of the right primary bronchus, which is a direct continuation of the trachea. Clear? That means trachea continues as the right primary bronchus, further continues as the secondary bronchus for the lower lobe, further continues as the tertiary bronchus for the posterior basal segment. And that is why when a child puts a foreign body in the nose, the foreign body directly goes to your answer, the posterior basal segment of the right lung. I hope this is clear to all of you. A foreign body entering the nose directly goes into the posterior basal segment of the right lung. Clear to all of you? Now tell me, when we lie supine, which is the lowest part of the lung in supine position? The lowest part of the lung in supine position is the apical segment of the lower lobe. Apical segment of the lower lobe. That's the lowest part of the lung in supine position. Can anyone tell me which is the most dependent part of the peritoneal cavity in supine position? Come on, students. The most dependent part of the peritoneal cavity in supine position. What is that? Any guesses? The most dependent part of the peritoneal cavity in supine position. Any guesses? नहीं, paracolic gutter नहीं है. It's the hepatorenal pouch of Morrison. Morrison's pouch है बच्चों, Morrison's pouch. The most dependent part of the peritoneal cavity in supine position is Morrison's pouch, and the most dependent part of the body in standing position in females. But if there's any fluid in the peritoneal cavity, if when a female stands up, the entire fluid will go down into which pouch? Which pouch is that? Rishi, that's the pouch of Douglas. In standing position in females, the most dependent part of the peritoneal cavity is pouch of Douglas. And in males, it is the rectovesical pouch. Rectouterine pouch in females and rectovesical pouch in males. ठीक है ना बच्चा? Yes. Very good. When silly mistakes होते हैं, that you should not make. But बाद में when you come outside the exam hall, you feel, oh, this I knew. Yeah. So similarly, the most dependent part, when we lie supine, the most dependent part of the lung in supine position is the apical segment of the lower lobe. Apical segment of the lower lobe, and that is how when a child is lying supine, when a child is being fed in supine position, the child vomits and aspirates the vomitus. So aspiration pneumonia is very common in your answer, the apical segment of lower lobe. Clear hai bacha? Aspiration pneumonia is very common in apical segment of lower lobe. Whereas a foreign body which enters the lung goes to the posterior basal segment of the right lung. Hope this is clear to all of you. Perfect. Very good. Yes, bacha, come on. Some rapid fire visuals for you. Answer, who's this number one? Who's this number one? Very good. Chalo, good. Yes, bacho, who's this number one? You should know this. You should know this. Yes, that's a phrenic nerve. Very good. That's a phrenic nerve. The nerve which goes in front of the hilum is phrenic nerve, and the nerve which goes behind the hilum is vagus nerve. So, what is this number 2? Identify this muscle. Number 2. Identify this muscle. What is this muscle? Number 2. Calenus anterior. Sternocleidomastoid nahi hai bacha, that's calenus anterior. Calenus anterior. Okay, what is this number 3? And what is this number 4? And what is this muscle number 5? Chalo bacho, if you know this, your concepts are clear. Number 2 is calenus anterior. Perfect. Who's number 5? Can anyone tell me what's number 5? Okay, number 3 is the brachial plexus. Number 4 is the subclavian artery. Perfect. And who's number 5? Number 5. Scalenus medius. Very good. Number 5 is the scalenus medius. So the brachial plexus and the subclavian artery, they lie between which two muscles? The scalenus anterior and the scalenus medius. Very good. So phrenic nerve, dekh lo, ek minute, just tell me phrenic nerve. What is the root value of phrenic nerve? C3, C4, C5. And there's sometimes an extra nerve, accessory phrenic nerve, which arises from C5 root of the brachial plexus. Now this phrenic nerve lies on the scalenus anterior muscle. The phrenic nerve enters into the thoracic inlet. The phrenic nerve lies in the superior mediastinum. Then it goes in front of the hilum of the lung. The right phrenic nerve goes along with the IVC into the abdomen. The left phrenic nerve directly pierces the diaphragm and enters the abdomen, and it supplies the diaphragm from the inferior aspect. Okay, so that's about the phrenic nerve. A phrenic nerve is a mixed nerve. It is motor to the diaphragm. It is sensory to the mediastinal pleura, to the diaphragmatic pleura, and it is also sensory to the pericardial. Okay, okay, fine. Okay, bachcho, coming to this topic now, the heart. Embryo, I mean, thorax is very small. Embryo of the thorax, we'll do it later in the embryology. Okay, bachcho, come on, let us discuss the heart. Tell me, what is this surface of the heart known as? Come on, answer this. What is this surface of the heart known as? You're looking the heart from front. Any guesses? What is this surface of the heart known as? This surface of the heart is known as the sternocostal surface. Sternocostal surface. Base nahi hai, bacha. This is not base. This is the sternocostal surface. And this sternocostal surface is made up of how many chambers? That's the right atrium, that's the right ventricle, and that's the left ventricle. So the sternocostal surface of the heart is made up of 3 chambers: the right atrium, the right ventricle, and the left ventricle. What is this groove here known as? This is the anterior atrioventricular groove. Anterior atrioventricular groove. And what is this groove known as? This is the anterior interventricular groove. Okay, so 3 chambers, 2 grooves on the sternocostal surface: the right atrium, the right ventricle, the left ventricle. The grooves, the anterior atrioventricular and the anterior interventricular groove. That's the sternocostal surface. What is this for the heart? That's the apex of the heart. Apex. Exactly behind the apex, what is this area of the heart? That's the base of the heart. Base. We turn the heart. This is the base of the heart. Base. Right? This chamber from behind is the base of the heart. Ye base of the heart hai. We've turned the heart, so that's the base of the heart. The base of the heart is formed by which chambers? Can anyone tell me? The base of the heart is formed by the right atrium and the left atrium. So that's the complete left atrium and that's the right atrium. Base of the heart is formed by both the atria. I'm directly telling you this. That's the base of the heart. Okay. The base of the heart is formed by the complete left atrium and the right atrium. And what is this surface of the heart known as? This is the diaphragmatic surface of the heart. Diaphragmatic surface of the heart is made up of, yes, the left ventricle and the right ventricle. Clear hai bachcho? So one is the sternocostal surface, the apex. Behind is the base of the heart. The base of the heart is formed by both the atria, and the diaphragmatic surface which lies on the diaphragm is formed by both the ventricles, the right ventricle and the left ventricle, mainly left, partly right ventricle. ठीक है बच्चों, what is this groove here? What is this groove here? This is the posterior interventricular groove. Posterior interventricular groove. And what is this groove? This is the posterior atrioventricular groove. Posterior interventricular groove and the posterior atrioventricular groove. Okay, are you able to follow this? I'm not going into details. I'm just telling you the main things. The sternocostal surface ke piche is the base. If I draw the heart in a side view like this, what is this? That's the sternocostal surface. That's the apex of the heart. What is this behind? That's the base of the heart. And what is this surface? That's the diaphragmatic surface of the heart. Diaphragmatic. Yeah. So sternocostal surface of the heart is made up of 3 chambers: the right atrium, the right ventricle, the left ventricle, 2 grooves: anterior atrioventricular, anterior interventricular. The base of the heart is formed by 2 chambers: the left atrium and the left ventricle. I'm so sorry, the left atrium and the right atrium, I'm so sorry. And the diaphragmatic surface is formed by 2 ventricles, the left ventricle and the right ventricle, right? The groove is posterior interventricular groove. Just answer this MCQ. The groove which separates the base from the diaphragmatic surface is, the groove which separates the base from the diaphragmatic surface of the heart is, come on, students, come on. The groove which separates the base from the diaphragmatic surface is, very good, Snehajit. Very good. Very good, surgeon. That's a posterior atrioventricular groove. Yes, Rishi. Very good. Posterior atrioventricular groove. Excellent. Yeah. Now tell me, where do the coronary arteries begin from? Okay. Just before that, Tell me, what is this number 1? What is this number 1 groove? What is this number 2 groove? Just name the groove. What is this number 3 groove? And what is this number 4? These are the grooves. Huh? What is 1? Come on, bacho, come on. Answer this. A small part is left. Thorax is a small topic. I'm finishing. A is anterior atrioventricular groove. Very good. What is 2? 2 is anterior interventricular groove. What is 3? 3 is the posterior interventricular groove. And 4th is the posterior atrioventricular groove. Yes, very good. 4th is the posterior atrioventricular groove. Excellent. Very good. Very good. So in short, I'll just tell you the coronary arteries. Okay. Clear with the grooves now, all of you? Yo. So the right coronary artery, just in short, I'll tell you. The right coronary artery arises from the ascending aorta. The right coronary artery first runs in the anterior atrioventricular groove. It runs in the anterior atrioventricular groove. Now goes in the posterior atrioventricular groove. It goes in the posterior atrioventricular groove. The right coronary artery gives a branch. What is this branch known as? This is the posterior interventricular branch. Okay. What is this branch? That's the posterior interventricular branch of right coronary artery. Posterior interventricular branch of right coronary artery. So the right coronary artery first runs in the anterior atrioventricular groove, now goes in the posterior atrioventricular groove. It gives a branch. What is that? That is the posterior interventricular branch of right coronary artery. Now what is this artery? That's the left coronary artery. It's a longer artery. The left coronary artery divides into 2 branches. It divides into 2 branches. What is this? This is the LAD. That's the left anterior descending branch or the anterior interventricular branch of left coronary artery. Now this anterior interventricular branch of left coronary artery runs in the anterior interventricular groove, now goes in the posterior interventricular groove and anastomosis with the posterior interventricular branch of right coronary artery, right? So this is the anterior interventricular branch of left coronary artery, or it is known as left anterior descending, Okay, so the left anterior descending branch runs in the anterior interventricular groove, now goes in the posterior interventricular groove and anastomosis with the posterior interventricular branch of right coronary artery. Widowmaker's artery. Yes, that's a widow. This artery is very commonly involved in MI. So the person dies, widow's artery. Okay, bacha, Vanshika, the left coronary artery. Look here once again, bacha, the left coronary artery. I'll make this in a bigger. Okay, look at this. Just remember the grooves. If you remember the grooves, now you'll understand the coronaries. Have a look. The left coronary arteries. The left coronary artery first runs in the anterior interventricular groove, now goes in the posterior interventricular groove and anastomosis with the posterior interventricular branch of right coronary artery. And what is this artery? This is the circumflex branch. That's the circumflex branch of left coronary artery. Runs in the posterior atrioventricular groove and it anastomosis with the right coronary artery. Okay, so the circumflex branch of the left coronary runs in the posterior atrioventricular groove and anastomosis with the right coronary artery. Here, bachcho, that's in short about the coronary circulation. Then it gives branches. The right coronary artery distribution you have to know. You have to know the distribution of left coronary artery. Now, this is the artery. This is the posterior interventricular artery, and this posterior interventricular artery is going to determine the cardiac dominance. Cardiac dominance. Okay. Arey Sankalp, let me finish this now, bache. Let me finish this, then we'll see the other topic. So, this is the posterior interventricular artery, students. And this posterior interventricular artery is a branch of the right coronary artery in 85% of the cases, and this is what we call as the right coronary dominance. This is what we call as the right coronary dominance. So if the posterior interventricular artery is a branch of right coronary, we call this as the right coronary dominance. If the posterior interventricular artery is a branch of circumflex, if the circumflex comes here and gives this branch. So if the posterior interventricular artery is a branch of the circumflex, this is what we call as the left coronary dominance. Okay, normally the posterior interventricular artery is a branch of right coronary, that is right coronary dominance. If it is a branch of circumflex, that's the left coronary dominance. And if there are two posterior interventricular arteries, this is what we call as a co-dominance. Co-dominance. Both right and the circumflex gives the posterior interventricular artery. We call this as the co-dominance. So who determines the cardiac dominance? The posterior interventricular artery. That determines the cardiac dominance. Fine, bacho. Now coming to the veins of the heart. If you can answer, what is this number 1? What is this number 1? What is this number 2? What is this number 3? The vein here. And what is this number 4? Chalo bacho, if you can answer this. These are very important MCQs. And what is this number 5? These are very important MCQs. The vein which the surgeon encounters in the anterior interventricular sulcus of the heart. Come on, students. The vein which the surgeon encounters in the anterior interventricular sulcus of the heart is the great cardiac vein. That's a great cardiac vein. Great cardiac vein. Okay, what is this vein? This vein in the posterior interventricular groove, this is the middle cardiac vein. Middle cardiac vein. Okay. Vishwa, if you are not able to understand, you see the other lecture. Okay. What is this? This is the small cardiac vein. Small cardiac vein, and this number 4 is the coronary sinus. Coronary sinus. Okay. So the vein which the surgeon encounters in the anterior interventricular sulcus of the heart. The vein which the surgeon encounters in the anterior interventricular sulcus of the heart is the great cardiac vein. Okay. Students who are NEET aspirants, if you want, just listen to the lecture. Okay. Don't comment. The vein which the surgeon encounters in the anterior interventricular sulcus of the heart is the great cardiac vein. The vein which the surgeon encounters in the posterior interventricular sulcus of the heart is the middle cardiac vein. In the anterior AV groove is the small cardiac vein. And the vein which the surgeon encounters in the posterior atrioventricular groove is the coronary sinus. Just remember this, bachcho, this is very important MCQ. Are you able to follow? ये समझ में आ रहा है कि नहीं? 5 is the marginal vein. Marginal vein. So how is the coronary sinus formed? Can anyone tell me how is the coronary sinus formed? Coronary sinus is formed by joining of two veins. Coronary sinus is formed by joining of the great cardiac vein and marginal vein. So great cardiac vein and the marginal vein joins to form the coronary sinus. And which groove does the coronary sinus lie? Bacho, it lies in the posterior atrioventricular groove, and this coronary sinus opens into, come on, answer this. This coronary sinus opens into, हाँ बच्चा, जो बीच में है वो कोरोनरी साइनस मिडिल कार्डियक वेन नहीं होगा. नहीं, वो नहीं है. पोस्टीरियर, दिस इज द पोस्टीरियर इंटरवेंट्रिकुलर ग्रूव, राइट एट्रियम, दैट्स राइट एट्रियम. ओके, दैट्स राइट एट्रियम. Yes, very good. It opens into the right atrium. Perfect. Come on, students, can you tell me what is this indicating? What is this indicating? What is this visual? If this comes as an OSPI slide or a visual slide for you, what are you going to write about this? Transverse sinus, that's excellent. That's transverse sinus. Transverse sinus lies between what and what? The transverse sinus lies between, yeah, what is this? This is the ascending aorta, and that's the pulmonary trunk in front, and this is the SVC behind, right? So the transverse sinus lies between the ascending aorta and the pulmonary trunk in front, and पीछे क्या होता? What is behind is the SVC. Like if you become a CVTS, a cardiovascular thoracic surgeon in future, and if you are going to operate on the heart, and if you want to control the blood flow from the heart, we put a ligature, you put a thread through this transverse sinus, and we can tie the ascending aorta. We can control the blood flow from the heart during cardiac surgery. Okay. Yes. Clear to all of you? Fine. And there's one more sinus of the heart that is known as oblique sinus. Oblique sinus. Tell me, where does the oblique sinus lie, bacha? Where does the oblique sinus lie? The oblique sinus of the pericardium, it lies behind. Answer. The oblique sinus of the pericardium lies behind what? Behind the left atrium. Yes, the oblique sinus of pericardium. Those sinuses. Sinuses, what is sinus? A space. So transverse sinus, I've told you the oblique sinus of the pericardium lies behind the left atrium, because the left atrium has to distend. Pulmonary veins, they open into the left atrium. Sometimes they bring more blood. So the left atrium has to distend. So where does it distend? Into oblique sinus. Okay. Listen. बाद में discuss करो. Discuss it later. Okay, clear बच्चा, clear. Very good. Okay, fine. Chalo, just tell me, what is this? What is this showing? What is this here and what is this? Any guesses here? What is this mediastinum and what is this mediastinum? This is the superior mediastinum and that's the inferior mediastinum. Superior and inferior mediastinum. So what are the boundaries of mediastinum? In front is the sternum, anterior is the sternum, posteriorly is the thoracic vertebrae, above is the inlet of the thorax, and below is the diaphragm. Okay. So this mediastinum is divided into two parts by an imaginary line drawn from the sternal angle. From the sternal angle, we draw an imaginary line which cuts the T4 vertebrae, divides the mediastinum into a superior mediastinum and an inferior mediastinum. Superior and inferior mediastinum. Up superior mediastinum is divided into three parts. Inferior mediastinum is divided into three parts. Chalo bachcho, can anyone tell me what are the contents of superior mediastinum? Okay, I'll just quickly make this for you. Superior mediastinum के contents follow: anterior part, middle part, and posterior part. If you can answer this, superior mediastinum. You get a short note on this. Anterior part. Follow. Superior mediastinum, anterior part. What do you get? You get the muscles sternohyoid, sternothyroid, and thymus. In the anterior part, you get sternohyoid, sternothyroid, and thymus. In the middle part of the superior mediastinum, what do we get? We get the arch of aorta, the SVC, the phrenic nerve, and the vagus nerve. Arch of aorta and its branches, the formation of SVC, the phrenic, and the vagus nerve. In the posterior mediastinum, what we get? In the superior part, we get the trachea, we get the esophagus, trachea, esophagus, the left recurrent laryngeal nerve, thoracic duct. Trachea, esophagus, the left recurrent laryngeal nerve, and the thoracic duct. बस इतना याद रखना है आपको. Anterior, middle and posterior part. Anterior part with sternohead, sternothyroid, thymus. In the middle part you get the arch of aorta, its branches, the formation of SVC, the phrenic and the vagus nerve. In the posterior part we get the trachea, the esophagus, the left recurrent laryngeal nerve and the thoracic duct. Inferior mediastinum, this is the anterior part, middle part, posterior part. Anterior part, what do we get? ये क्या draw किया मैंने? If anyone can tell me what is this? Inferior mediastinum. Inferior mediastinum. Anterior part, what do we get? What is this? This is the superior and inferior. Superior and inferior sternopericardial ligaments. Superior and inferior sternopericardial ligaments. That's the superior and inferior sternopericardial ligaments. In the middle part, what do we get? We get the heart and the pericardium. Okay, we get the heart and the pericardium. What else? We get the phrenic nerve. Some books mention phrenic nerve behind the phrenic nerve, and we get perihilar lymph. In the posterior part, we get trachea. Trachea khatam ho gaya. Descending thoracic aorta, azygous vein. Very good. Hello. Azygous vein, hemiazygous, accessory hemiazygous. Voice is cracking. Hello, hello. Azygous vein, hemiazygous vein, accessory hemiazygous vein, and thoracic duct. So just in short, I've told you. Dear bacho. So in the inferior mediastinum, anterior part, you get the superior and inferior sternopericardial ligaments. In the middle part, we get the heart and the pericardium. We get the perihilar lymph nodes because the hilum of the lung comes here. The phrenic nerve. In the posterior part, we get vagus. So vagus posterior, mein mention karte, some books mention the posterior. So trachea, esophagus. Okay. Trachea, trachea is gone. Sorry, esophagus. The descending thoracic aorta, the azygous vein, the hemiazygous, the accessory hemiazygous vein, the thoracic duct, and the vagus nerve. Okay, that's fine. Perfect. Just remember all this, bachcho. Okay. Ek chota sa, I'll tell you about the thoracic duct. You tell me thoracic duct begins in the abdomen. Right? Small last part I'll tell you. Thoracic duct begins in the abdomen as a large lymphatic duct. Tell me the name. Tell me the name. What is this in the abdomen? What is this big lymphatic channel in the abdomen? Iska naam hai cisterna chyli. Cisterna chyli. So जब thoracic duct, very good, the thoracic duct begins in the abdomen. एक बड़ा lymphatic channel है, a big lymphatic channel which is known as cisterna chyli. From the abdomen, the thoracic duct now comes in the thorax to the aortic opening of the diaphragm. Perfect. Aortic opening of the diaphragm, it comes in the thorax. First, the thoracic duct lies on the right side. It ascends in the posterior mediastinum. At T5 vertebral level, the thoracic duct crosses to the left side and then it ascends in the superior mediastinum and the thoracic duct opens at the junction of the left. Yes, what is this? That's the left internal jugular vein and that's the left subclavian vein. So where does the thoracic duct open? At the junction of left internal jugular and the left subclavian vein. That's the course of thoracic duct. Samajh mein aaya? Is this clear? Thoracic duct begins as a large lymphatic duct, cisterna chyli, enters the thorax through the aortic opening of the diaphragm, lies on the right side, ascends in the posterior mediastinum, crosses to the left side at T5. Now it ascends in the superior mediastinum and opens at the junction of the left internal jugular and the left subclavian vein. That's the thoracic duct. What are the tributaries of thoracic duct? Tributaries of thoracic duct is number 1. Yes. The left broncho mediastinal diaphragm. from the left side of the thorax. ये thorax से लेके आएगा, the left bronchomediastinal lymph trunk will bring lymph from the left side of the thorax. The left tubular lymph trunk. This will bring lymph from the left side of the head and neck. And the third is the left subclavian lymph trunk. Left subclavian lymph trunk. This will bring lymph from the left upper limb. Okay, so the left bronchomediastinal lymph trunk brings lymph from the left side of the thorax. The left internal jugular lymph trunk brings lymph from the left half of the head and neck, and the left subclavian lymph trunk. Okay, so then you will ask me, Bachu, what about the right side? So right side pe bhi there's a right lymphatic duct, and this right lymphatic duct will receive this three tributaries, 1, 2 and 3 on the right side. On the right bronchomediastinal, right subclavian and right internal jugular lymph trunk, they will all drain into the right lymphatic duct, and this right lymphatic duct will open at the junction of right internal jugular and the right subclavian vein. That's a right lymphatic duct. On the left side, there's a thoracic duct. And you get this posterior intercostal lymph node. They also drains into the thoracic duct. Left posterior intercostal lymph node. Clear, students? That's about the thorax. Embryology of thorax, we'll discuss it in embryology topic. So thorax may very important, which you should know, must know questions. Intercostal space, must know question. Pleura, bronchopulmonary segments of the lung, the heart, the coronary circulation, that's a must know topic. Azygous vein, the thoracic duct, right? And diaphragm, will discuss it in the abdomen. Fine, bacho. So remember, this topics, this are must know topics, and when you prepare an LAQ, automatically SAQs gets prepared. So fine, students, I hope this lecture is clear to all of you, and then we'll meet on Tuesday. I think it's abdomen. We'll see. Okay, thank you, my dear children. Thank you to all of you. Have a very pleasant night. Study. If you have any doubts, you can ask on PW Med Ed channel. Okay. Thank you to all of you. Thank you to all of you. Mammary gland are easy and upward. Okay, I'll tell you in the next lecture. I'll tell you. Thank you, bacho. Thank you. Next, I think is thorax and abdomen. I think, and abdomen. I think. Next class would be on Tuesday, bacho. Tuesday 7:30. Tuesday 7:30. Wait. I'll tell you. Just wait. One moment. Next class. Okay, got it. Next class is abdomen and pelvis. Abdomen and pelvis. Yes. Bacho, this anatomy, this basic sciences are very important. When I teach the interns and the post interns also, I find that if the basic sciences are good, the students are very confident. So to gain confidence on your clinical and the paraclinical subjects, your preclinical subjects has to be perfect. The base has to be very strong. Only then you will get confidence in your clinical subjects, and then you'll be able to crack your NEET PG exams. Okay. Thank you, my dear children. Thank you to all of you for this listening of the lecture. Thank you. Bye.